I chose the title, Why Your Doctor Owes You Empathy, for two reasons. I wanted to be emphatic that empathy is not an ornamental or frill of part of medical practice, that it is an essential part of effective medical care. Why? Two reasons. First of all, patients, which is basically all of us at some point, patients can tell if their doctors lack empathy. They can tell, and they don't trust their doctors if they lack empathy, and they don't disclose important information. So, number one, you won't be able to practice effectively because the patient won't form an effective therapeutic alliance with you if you lack empathy. Secondly, doctors need to have empathy because what is the subject matter? What are they doing? They're trying to help people with their health and their problems and their health problems. And what is that? I mean, we are bodies, and we actually can be understood to some very interesting degree as bodily mechanisms. But if you really want to help people recover, function, live with disability, live with all kinds of challenges, take good care of themselves, and ultimately help them with the dying process, it turns out just dealing with the body as a mechanism is not enough. You actually have to know something about illness as well as disease. You have to know about things like pain, weakness, dizziness, nausea, lethargy, muscle aches. Basically, most of those things, all of those things are actually subjective. There's no way to get to the subjective part of a person besides empathy. So if you're in the business of, we have some great bicycles in the audience. If you're in the business of fixing bicycles, you can just deal with mechanisms alone. But if you're in the business of medicine, you really need to have that perspective, or you won't be dealing with most of the subject matter that you're expected to address.